Hi folks, it's Matt Scholl again. This is episode 6 in the COVID series, or so I'm told. Before we get to the meat and potatoes today, there's a couple of questions that came out since our last video. The first one pertained to the use of masks in the general population. The answer in the medical community is that there is not a lot of medical evidence to support the use of masks. The concern is that in wearing the mask itself, it may be ill-fitting and it may cause patients or individuals to readjust their masks, touch their face, and increase their risk for getting COVID. The other issue pertained, in fact, to takeout food. Takeout actually is not at all discouraged, and in fact, the health unit suggests, if at all possible, when you're ordering, to prepay, and if available, make use of carside or curbside service. So now, with that being said, hopefully everybody's doing well, and if you are experiencing cabin fever to a certain extent, well, that's probably because you're doing what you're supposed to be doing and keep doing exactly that. Last week's infomercial was, from what I gather, a little bit lengthy, and in hindsight, it was probably a lot longer than my attention span, for sure. So that said, I'm hoping to be a little bit more brief, but my concern was that the last point we talked about last visit, I'm not sure if it's coming across the way it should be. So today things might seem to be a little bit more pointed, and that's not usually my shtick. And so if some of my comments do offend you, well, this is an official preemptive apology for what that is worth. So all right, check it out. I know the concept of social distancing is nothing new. We've been talking about this really since January. And look, COVID's going to affect us. We will see cases on campus. It's going to happen, and we anticipate this to happen. It could be any one of us. It could be anybody. It could be an unsuspecting professor, a pharmacist, anybody, somebody in the service industry, or even a loved one. And we see it here. COVID hysteria is increasing, and rightfully so. This is coming across loud and clear. The latest data show that the cases are increasing, and so this is a problem. We're still in the upswing, and this is a very concerning issue to all of us. This is met with varying degrees of upsetness when we hear that there are still small groups out there that continue to function as if nothing is happening, and basically it's like business as usual. There are those of you that are not practicing social distancing. You're congregating together, playing group sports, for example, basketball. These things are completely unacceptable. This is selfish behavior and has to stop. You've heard it from politicians, epidemiologists, medical officers of health from every level, be it on the federal, provincial, and local level. This is a very frustrating situation, and if those of you that are exhibiting this kind of behavior think it's okay or can continue to do this, I can only assume that either, number one, you're dangerously uninformed or misinformed, or number two, blatantly you just don't care. And in my mind and in my heart, I know the latter just can't be the case. So please keep in mind, it's what you do now and what you've done for the past 14 days that can be potentially very serious in terms of consequences for not only yourself, but those people that are around you, people that deserve better. So if you can see fit to stop this self-centeredness, this self-centered behavior, and get with the program, please, along with your university family, we all implore you, join the rest of us that are doing the right thing and are all in this together. Take good care and stay well.